Definition: a quick and early reaction to infection or injury. It begins within minutes and lasts for a few days. It is part of the innate immune system, meaning it is nonspecific and happens before the adaptive immune system responds. Main causes: infections, trauma, dead tissue, necrosis, foreign bodies like splinters or crystals, key players, mediators, toll-like receptors, recognize microbes, arachidonic acid metabolites like prostaglandins and leukotrienes, white blood cells, neutrophils and eosinophils, antibodies, especially already existing ones, mast cells and basophils release histamine, complement system helps destroy pathogens. Factor 12, Hageman factor, involved in clotting and inflammation. Inflammasome detects danger signals and activates IL-1, a key inflammatory cytokine. What happens? Vascular events: vasodilation, more blood flow to the area. Endothelial cell contraction makes blood vessels leaky, causing edema. Cellular events: neutrophils leave the bloodstream and enter the tissue. They gather at the injury site and become activated. Possible outcomes of acute inflammation: 1. Resolution and healing, aided by IL-10 and TGF-beta 2. Ongoing inflammation, if the stimulus remains, IL-8 involved. 3. Abscess formation, a walled-off pocket of pus. 4. Progression to chronic inflammation, when antigen-presenting cells activate T helper cells. Scarring, if tissue cannot regenerate. Erythrocyte sedimentation rate, ESR. What it means. What is ESR? It's a test that shows how quickly red blood cells fall to the bottom of a tube. In inflammation, proteins like fibrinogen cause RBCs to stick together and fall faster, so ESR goes up. High ESR causes: most anemias, infections, inflammation, e.g. giant cell arteritis, polymyalgia rheumatica, cancer, metastasis, multiple myeloma, kidney disease, end-stage or nephrotic syndrome, pregnancy. Low ESR causes: lower than expected. Sickle cell anemia. RBCs have abnormal shapes. Polycythemia, too many RBCs dilute proteins. Heart failure affects circulation. Microcytosis, small RBCs fall slowly. Low fibrinogen, not enough protein to clump RBCs. USMLE style question 1. A 75-year-old woman has a new headache and jaw pain. On exam, she has scalp tenderness and blurry vision. Her ESR is 100 millimeters per hours. What is the most likely cause of her symptoms? A. Iron deficiency anemia. B. Polymyalgia rheumatica C. Giant cell arteritis D. Sickle cell disease. E. Systemic lupus erythematosus. Correct answer C. Giant cell arteritis. Explanation: giant cell arteritis is an inflammatory disease of large arteries, usually in older adults. Symptoms include new headaches, jaw claudication, vision problems, and a very high ESR. Why not the others? A. May raise ESR but does not explain her specific symptoms. B. Often occurs with giant cell arteritis, but usually causes muscle pain, not jaw or scalp tenderness. D. Typically causes low ESR, not high. E. May cause high ESR, but usually has other systemic signs like rash, kidney issues, or joint pain. USMLE style question 2. Which of the following most accurately describes the role of the inflammasome in acute inflammation? A. It produces antibodies against microbial proteins. B. It triggers the clotting cascade. C. It detects harmful signals and activates interleukin-1D. It transports neutrophils to lymph nodes. E. It breaks down dead cells into antigens. Correct answer C. It detects harmful signals and activates interleukin-1. Explanation: the inflammasome is a protein complex inside cells that detects cell damage or infection. Once activated, it leads to the release of IL-1, which is a powerful inflammatory signal. Why not the others? A. Antibodies are made by B cells, not by the inflammasome B. Clotting is handled by factor 12 and platelets. D. Neutrophils go to the site of injury, not to lymph nodes. E. Dead cell breakdown is not the main role of the inflammasome.